no financial disclosure. A year ago in Bucharest, we discussed about actually how we came up with that test of supine test. What the reason was, we were looking for lacrimal gland prolapse. Then I introduced you a year ago the supine test. We will review it in a few seconds. And then I showed the procedure, how we fix it. Now, the aim is how to specifically, preoperatively diagnose if the patient requires lacrimal gland reposition intraoperatively. When you go to the literature, the only sign we find in there is the lateral eyelid bulging, but we know that lateral eyelid bulging can be resulted from either a fat prolapse, severe dermatocalasis, lateral hooding of the eyebrow, or lacrimal gland. That supine test, actually what it does, when you ask the patient to lie down, you are asking the fat to go inside the orbit, as you see in here. If the laser pointer, as you see in here, it will go down. Asking the patient to look down, the dermatocalasis will be disappearing, and then by pulling up the eyebrow, we are actually causing the lateral hooding to disappear. Then the only hard tissue remain there is the lacrimal gland. This is how it works. Would you run the movie, a short, very short movie? Yeah, click on that, yeah. You see, this patient doesn't have lateral eyelid bulging. When you look there, there is no lateral eyelid bulging, whereas, yeah, in side views, look there, there is no lateral eyelid bulging, whereas, yeah, in side views, and based on the literature, we shouldn't be suspicious of lacrimal gland prolapse, whereas asking the patient to lie down and look down, pulling the eyebrow up, this is the hard tissue you see over there, and this is the basis for the lacrimal gland prolapse detected in supine test. Three outcome measures. Want to assess the validity of the lacrimal gland prolapse, giving you the frequency, and the third, assessing the predictive value of lateral eyelid bulging in our patients. We preoperatively recorded lateral eyelid bulging based on the amount of protrusion from the superior orbital rim into mild, moderate, severe, and out of more than 1,200 cases in 6.5 years, firstly, the first outcome measure was to basically go and see what the supine is. All the patients with positive supine tests had 3 millimeter and more of lacrimal gland prolapse. So when there is a different grade of severity, when there is positive supine test preoperatively, we need to be prepared to open the septum and fix it into different ways. And then, second one is the frequency. If you look at this very crowded table, you will see 10% of the patients under age 40 already have lacrimal gland prolapse, which is increasing in significance. Second one is the frequency. If you look at this very crowded table, you will see 10% of the patients under age 40 already have lacrimal gland prolapse, which is increasing insignificantly by increasing age. However, the severity of that lacrimal gland prolapse is increasing from almost 8% in patients under age 40 to almost 40% in patients more than 60 years of age, which shows the age does play a role. However, it needs a predisposition inherited in some patients. With regard to the reliability of lateral eyelid bulging, we found it is good for, it has a very good negative predictive value, means that when there is no eyelid bulging, it is highly predicting we don't have lacrimal gland. However, have a look in here on this picture. Sometimes you have bulging, increases by increasing age. Depending on the severity of basically lacrimal gland prolapse, we can use non-surgical, non-suture or suture technique to reposition that. Supine test is a very reliable, very simple test to preoperatively diagnose lacrimal gland prolapse of 3 millimeter and more. You can find all these data recently accepted for publication in JOPRS, which has been included 2 movies of our techniques for both mild and moderate to severe lacrimal gland prolapse. And remember, final word is, if you don't look for lacrimal gland prolapse preoperatively, you won't find it in the right time. It will find you in a very, very wrong time. Thank you very much.